Now, Prime Minister Narendra Modi yesterday appealed to people to not resort to panic buying and hoarding in this time of coronavirus pandemic. He says there is no need for such activities, and he said that people were to change their thinking towards overstocking. The Prime Minister also called for a Janata Curfew on Sunday between the hours of 7 a.m. and 9 p.m. in an effort to curb the coronavirus pandemic. Now, this is the number of infections crosses 200 in India. 4 fatalities have been confirmed. The Health Ministry earlier confirmed that there was no shortage in essential supplies. For more information on this, let's cut across to WION's political editor, Kartikeya Sharma. Kartikeya?
Alison, this is a step taken by the Prime Minister, Narendra Modi, to have all the chief ministers and the health ministers of the country on the same page. Yesterday, he addressed the nation and he requested everyone to cooperate in context of how hard it will be for the Indian government to tackle this pandemic and the steps they need to take. So he made it into a collaborative affair. And this has been the style of the Indian Prime Minister Narendra Modi, that he turns social issues into campaign whereby public participation, he implements social policy. And one of the best and the most successful example of Prime Minister effort has been Swachh Bharat. Now, in this context, Prime Minister is meeting all the senior officers, chief ministers and health ministers of different states of India. So in this meeting, which perhaps is going to last over 2 hours, Prime Minister is going to hear each and every chief minister. He's going to give them suggestions. He's being accompanied by the health minister Harshvardhan. So it's a very unique attempt on part of the Indian Prime Minister to get everyone on the same page, because in India we have a centers list, state list and a concurrent list. Health is part of the concurrent list, which means that the central government makes policies, but the implementation has to take place by the state government. So the collaboration of the center with the state becomes very, very important, because state will be at the front line in combating coronavirus. So it's a very unique, novel, and a very important step taken by the Prime Minister.
Kartikeya, we know that different measures have been implemented in different states around India, Maharashtra being the worst hit. Now we heard this morning that is under a partial lockdown. What does this mean for the residents in Maharashtra?
The partial lockdown is that basic commodities, services, public transport, on the 25% of the government staff would be available. Rest would be shut down, because there's a belief in the central government that if we are able to cut the mobility of people, we will be able to stop the transmission. And I think the whole effort on part of the state governments and the central has been in that direction. But the effort in context of Maharashtra has been specific to 4 big metropolises, including Mumbai, Nagpur and Pune.
We also saw Prime Minister Modi with the initiative of the video conference among all SAARC leaders, and he has been widely hailed for this move. This is a very similar move within India.
It's a similar move. Prime Minister mooted that idea. It was a good idea. Then the Prime Minister has also mooted the idea of G20. Prime Minister believes in a collaborative approach when it comes to fighting pandemic. Though a lot of people were of the opinion that was it required? I would say it was very much required, because India is not only a thought leader in the world. India is the biggest country in the SAARC. India has a position in context of the new global order, and Prime Minister asserts and projects that vision of a new and vibrant India. India has taken the lead. India has also exported medical equipment to China. India has helped SAARC nations in airlifting students and people who were stranded in Wuhan. So India is a leader in its own right. But coming back to this issue, I would only say at the end that Prime Minister is taking every state government on board, because India has a federal structure, and the health of people comes in the concurrent list, which means center can give money, center can make plans, but it needs to be and should be and has to be implemented by the state governments.
Kartikeya, thank you very much for joining us. That is WION's political editor, Kartikeya Sharma, joining us for the latest.